This page here is the Bates Visual Guide to patient examination, including the OSCEs. This is our new software that we see here. This will also be the software that is used for Acklins as well from January, and we will show you previews of the material if you're interested today. On this screen then, when you come here next, you will see not only Bates, but also Ackland. If I choose to open this up, we can see the sections of this Bates Visual Guide. Think of this as a guide to patient examination. So how a student or a doctor is going to be able to not only examine a patient and gather information and make notes, but also how they can build a rapport with their client or their patient, because this is very, very important. This is one of the most important things for a student or a doctor to learn, because if they have a close rapport and a close cooperation, then their treatment is more likely to be effective, because the patient is more likely to do the things that they suggest. This is divided into 3 sections. This first one that we see here is about the examination of the patient. The patient examination section is divided up into 2 pieces. This first piece that we see here, from step 1 through to step 6, this is all about examining the whole patient, so head to toe. We can see that this is about examining the whole patient as an adult or a child or an infant, as we can see it through the page here, or even for pregnant ladies as well. All the way down to step 6, this is about examining the whole person. Below that, you can see this second section from number 7 through to number 21. This is about examining a system or a part of the body. So we can see here things like examining the skin, hair, and nails, or the eyes, or the ears and the nose, for example. Each of these sections from 1 to 6, and also from 6 to 21, is presented in a very standardized way. Let me take you into this example. This is an example of examining an infant from head to toe. So you can see here that it follows that process from the beginning to the end. We can see it there. This first entry that we see here is all of those videos together. So that is half an hour, so 30 minutes. But you probably don't want to do that. Each of these sections, though, is just that small part about that part of the examination. So let me open up one of these entries to let you see that individual example. This is about examining an infant, and this is about examining their head or their face. This first section that we see here lets you see where this is inside this list of videos. We can also open up the sections of this part of the video. So these are all of the individual pieces of this video that we see in the center of the screen. Up at the top of the page, I can make a link which takes me back to this section. So if I want to put this into a web page or a learning management system, this is my process. If I open up the video, we see it in a new screen, and I can look at the voice. We can turn on the captions. We can make the settings, and we can change the resolution, and we can also open it up full screen. At the top of the screen here, we can actually see the transcript. These are the words that the narrator is saying. If I needed to, I can download that transcript from here. So it will allow you really to listen and read and learn this information more successfully. On the screen at the moment, you can see that individual video, and we're able to see the pieces of that video, and we can see how it progresses. In this first section here, from parts 1 through to 6, we are examining the whole patient. And the way that these videos are organized is that they are organized with the most detailed ones first, the most general ones first through to the less detail. It doesn't just tell you, though, how to examine. It also tells you how to record the information that you are finding and to make notes about the content as well. Down below level number 6, we can begin to see these other types of videos that are here. This one is an example about examining the skin, the hair, and the nails. The way that this is introduced, again, is with the most general information first. Then it tells you about the structure of the skin, the hair, the nails, and it gives you instructions about how to examine it, which is what this is about. It tells you about the notes and the observations that you should make, but it also gives you some information about how to take samples of these tissues. So if I'm taking samples of hair or skin, this is about the pathology and special maneuvers that we see here. How to examine the skin, how to see whether it is healthy, how to take laboratory samples as well. If I show you another one of these, you can see that this is a standard format. It introduces you. It talks about the nerves and the tissues. It then lets you take the examination and also it tells you about taking samples for that particular examination. So the notes that you need to take, the samples that you need to take as well. So this is an important step, I think, for doctors and people who are training to be nurses and other allied health professionals. On this first area here, we are looking at physical examinations. And if I move away from this and I move to this third area here, you can see that these are clinical skills videos that we see here. if we have studied the examination videos, what we can do here is we can come and we can apply the information that we have learnt. If we have learnt about examining an infant or a child, we can then come here and we can see an example of how we can apply that information to actually dealing with an individual patient. So the child here has been complaining of vomiting. He has nausea and vomiting. So it goes through the process of examining the patient, of asking them questions, of gathering information, and applying the information that you used from that physical examination video to maybe think about what is wrong with this patient and how we can help to diagnose his problems. So these two sets of materials, the physical examination, maybe of the child, and then the objective, structured clinical examination skills videos are actually a challenge. They are a challenge to help you to understand the reasons for the things that you have learnt. In between those two, you have the communication and interpersonal skills videos here. This is a very important part for students for learning how to deal with patients and clients. The statistics tell us that the more connected a patient or a client feels with a doctor, the more likely they are to have a successful communication and the more likely the patient is to recover. So the connection is a really, really strong idea here. If a patient doesn't connect with the doctor, they're not likely to take the advice about exercise, about diet, about therapy, because they don't have that inspiration. So here we can see some examples of how we can build communication, how we can build rapport, how we can be persuasive, how we can really help to reassure or calm a patient, how we can give them bad news if that is necessary. And even here, thinking about the different sorts of clients and patients, how do I build rapport with a baby when that baby does not yet speak with language? So you have to have different sorts of skills to deal with infants and newborn or young children. This is a whole different area of communication. We can also think of patients who are in different categories as well. Meet people who are mentally ill-prepared or physically disabled. They may have specific problems. Each of these small videos then will give you ideas about the sorts of problems that are encountered and the ways to overcome those issues that we can see through the page just here. With all of our material, whether it's with Acklins or Bates, there is help which is built into this software that really helps us to understand how to use it. And there are, if I open up any of these videos, there are links up at the top of the page to enable us really to go back into this video in a very effective way. So we've had a quick look then at the Acklins Video Atlas and also at the Bates Visual Guide to Clinical Examination. And we've seen how these both can be used as a part of training for a doctor or a nurse or a health professional. Both of them are very useful in medical training. People often think of these just as being for doctors, but they are very important for other sorts of health professionals as well.